This interview was recorded at the Psychedelic Science 2025 in Denver, where we spoke with leading voices in psychedelic research, therapy, spirituality, and policy. Senator Jeff Steinborn is the sponsor of the Medical Psilocybin Act in New Mexico, a visionary step toward expanding access to psychedelic therapy. In this conversation, he discusses why legislative action was necessary, how to ensure inclusion for marginalized communities, and what benchmarks will define success as New Mexico opens its first healing centers. Senator, can you explain us how this new Medical Psilocybin Act, which was just adopted by the legislature in New Mexico, will improve the health and well-being of the citizens of your state?
Sure. So psilocybin is another option for people who need another option to help with serious behavioral health conditions. Now the data is telling us it could possibly be helpful for lots of conditions. But, in our law, we build 4 medical conditions into the law. Post-traumatic stress disorder, a lot of veterans, first responders, people with major depressive disorder, often treatment-resistant depression where maybe pharmaceutical drugs don't work, huge side effects there. Substance abuse disorder, and then the 4th condition is end-of-life anxiety and kind of palliative care. So, but then our law gives the Department of Health of New Mexico the authority to add other what we call qualified conditions if the data supports that. So, it's going to help people with those conditions to have another treatment opportunity that may really could even save their life. Yeah, but certainly improve the quality of their life.
Why did you decide to go through the legislature and not through ballot?
Well, in New Mexico, we don't have a ballot initiative. So it's not an option that we turn to and that, it's not literally allowed in our state. So, being a legislator, that's all I know, how to change the law and create a new program is through legislation. And, the bottom line is the support was there, that when I started working on this, I thought that politically we would fall into the same almost predictable political turf of the drug war that we've seen through decades that might be applied and laid over how we looked at psilocybin. And what I found was, thankfully, through a lot of great advocates who have been working in this space for a long time in New Mexico and through previous attempts at different kinds of legislation, but that there was actually a lot of bipartisan, meaning there were both Republicans and Democrats open to it. It wasn't just Democrats who supported, but Republicans were totally against it. There were Republicans who were in favor of this, and I was in the legislature at the time, who were against creating medical cannabis and legalization of cannabis, totally against it. This was different. And I was surprised as anyone to see that. But when I saw that before I started from the very beginning. I sought out I'm a Democrat, but I sought out Republican colleagues to partner with me on this. Very conservative, not known as maybe the most conservative, but in one case, Senator was a veteran, and I just said, "How do you feel about this? And are you aware of this?" And he was, and he said, "Sure, let's do it." And we went forth together, and so ultimately it worked out.
Did you face any significant opposition? And if yes, where did it come from?
Yes, we did. I mean, in the sense that I think we were up against some of the predictable entrenched skepticism of, okay, wait a minute now. We're a state with a lot of addiction, a lot of poverty, a lot of social ills, and now we're going to legalize another drug, a quote drug, to help people, to help people. And I'm skeptical, right? And so it was a process of showing them data that, yes, in fact, this is a plant medicine. If you get beyond the term drug, you understand this is something in nature, psilocybin. Our bill dealt with the natural whole mushroom, not synthetics. That was a decision that we made, that in fact, there's lots of research showing that it is medically helpful. And that's what we all needed to be focused on if we wanted to help people. And if that was your objective, then you needed to be serious about the research. The Federal Food and Drug Administration, the FDA of the United States, ruled psilocybin as a breakthrough therapy for major depressive disorder. Well, that's pretty huge. And they've done that twice through the years. So, that was really helpful for me to kind of win over those skeptics. But not just me, the advocates who came to the committees when I was passing the legislation. Doctors, veterans talking about their personal experience. It was those testimonials that really, more so than me and even the data itself, that really won them over. And it's like, you gotta be a pretty cold person and not want to give those kinds of people an opportunity at healing. So ultimately, we even won them over. Not all of them, but I think in the entire legislative process, I might have had less than 10 or 15 dissenting votes the entire process. So it was pretty amazing.
How do you mitigate the risks of psilocybin going into the wrong hands?
Yes, our law in New Mexico now falls to the New Mexico Department of Health, which is responsible for, health policy in the state of New Mexico. And we delegate to them to come up with the rules on who can administer psilocybin. It can only be administered in a medical setting. There's a lot of rules involved in this law and will be this program. You have to go to a medical setting. They will be the one giving it to you. The state will license even the producers of the psilocybin. That no doubt will be done in New Mexico. So the dosage and the quality are maintained. And then there has to be an incredible amount of education given to patients ahead of time on safety, risks, making sure you're screening for people who maybe it's not safe to take it. We know that there's certain people that have higher risk of having an adverse outcome, and we don't want that. Frankly, there's people that probably should not, it's not safe for them to go this route. We need to figure that out, and so we have to create a lot of safety sideboards and parameters, and that's what I'll be pushing for, and I know a lot of people in our state want to make sure we get it right so that it is safe.
Were there any lessons learned from your experience with cannabis regulation?
I think it's very different. I was there when we created a medical cannabis program. We started with medical cannabis, and then only years later, up until a few years ago, did we legalize it. Those are really two different things. When we created a medical program, I think it was great. It helped lots and lots of people. When we created a legal program, we flew the floodgates open, and we had problems with so many different people trying to get into the space that it was a new market and it was a bit of a gold rush. And so there were inherently problems with that, and I don't think we gave enough time or maybe resources to our regulators to do that. So that was probably a big lesson learned, that if we're going to create this medical program, let alone for psilocybin, something this serious, we need to give them enough time. We need to give them the resources so they can hire the right staff. So I fought very hard, not only to pass this bill and a good bill, but to make sure we secured enough money for the Department of Health to be able to hire staff, also to create a big time window. So our law, the law goes into effect July 1st officially, but they do not implement a program. The law creates a timeline where the program has to be actually started, where patients are getting treatment by December 31st of 2027 of December. So we're giving several years for the department to hire staff, create rules, do all the things we talked about. So through time and resources, that's the biggest lesson learned, is don't rush it, recognize how much time it really takes to create a program, and make sure they're staffed accordingly. And honestly, I think one of the lessons learned, not just from New Mexico, but other states that are now doing this, is that you need to sufficiently fund the government that you're expecting to run this. You can't look at this as like, okay, there's a market out there, and so we're going to expect that market through licenses and everything else to have to pay its own way. I think there's a little desire out there for, frankly, there to be more resources and that's, I think, a lesson New Mexico can learn from that is, let's not go that route, because this is, at the end of the day, patient care we're talking about. We're talking about psilocybin in the scope of a public health system. It's a little different. I think they look at it that way too. But if you're really serious about that, and we're getting very serious about behavioral mental health in New Mexico, treat it like you would other behavioral health solutions. And if you want to get it right, and you want it to really help a lot of people, then you need to fund it. So I hope that will be one thing that proves to be smart for us.
One big issue with psilocybin treatment is the high price. How can you make sure that less advantaged people can have access to treatment?
Absolutely. Well, so one thing we did in New Mexico, and we're the first one to do it, but we're only the third state to do it. So we created what we call a psilocybin equity fund, a health equity fund. So the idea is that we, as a state, will put funds into this pot of money so the state can fund treatment for people who can't afford it. And that's how we make it equitable. that we recognize there's people out there who need it, who don't have the resources to do it, and we help make treatment available as funds are available for that. And quite frankly, there may be foundations and other well-funded private and public, foundations and others who want to give money to the state for that fund, knowing that we're going to establish a program within a program to be able to make it available to people without the means. So I think that'll be big for our state, and probably other states will take note of that and recognize that, and maybe the foundations and people who want to help pick up the slack. The other thing is, by publicly funding this program, that in and of itself, I think, will make it more affordable. Because if providers have to pay their own way and fund the program themselves, which I think is what we're seeing in other states, what are they inherently going to do? They're going to have to charge a lot of money because they're having to pay a lot of money to run a government program. If they're not having to do that, then their barrier to entry is less, they can charge less. So I think hopefully all of it will keep it accessible in New Mexico. And we're also going to collect data. So data collection's built into our law, so we're going to track who's getting it demographically, who are they, income, et cetera, and access to care will be super important in New Mexico.
Are you going to provide funding for the training of new professionals?
Yes, that's a good question. The Department of Health, that's one of those things that's yet to be determined. The department will figure out the rules on what are the requirements for being a licensed provider. Our law does say licensed, but in terms of what type of credential, that's to be determined. I mean, some may say only a psychiatrist, psychologist, but it could be certainly nurse practitioners or other types of, medical professionals. What kind of training they get and who they get it by. This is kind of an emerging area that I'm very interested in. Who does provide this training? In fact, it's something I've brought up with MAPS themselves, is I think as states move into this space, can we standardize training? Can we create, and there's certainly universities providing this training around the country. New Mexico, I don't think has gotten into this yet, but maybe we will. So it's a great question, though. Something that will be super important, because at the end of the day, you want super qualified people facilitating these medical treatments. So important, and to safety as well as efficacy.
So Senator, you seem very committed to this cause.
Yes.
What made you so interested in psychedelics? Was it a personal encounter with people suffering from problems, or?
I got a call from a constituent, someone that I represent, on my way to a legislative session, actually, in 2024, beginning of the year. And she said, what are you doing with psilocybin? And she told me her story, that she grew up being a victim of abuse and lifelong trauma, and, had taken suffer of major depressive disorder, and that she sought out microdosing on her own because she had heard it could be effective, and it was. But what we were doing. So I really felt compassion, and we owe it. That's my job. That's my job. If I have no other job, it's helping people. And so on a compassion level, I felt like if there's a tool out there, that can help people, and the data shows that, then we need to be doing that. And that's what drove me to research this, and ultimately it led down the path of, first in 2024, so that year when I got that call, I introduced a bill that session to have the Department of Health study it, and then bring us back the results and a recommendation. And that was a very comfortable, methodical approach. And then thankfully the Department of Health, to their credit, that's a strength in New Mexico at this moment, was they were partners really in creating this. They recognized this could be a great harm reduction tool, and that the data supported it. So we then worked together on a bill to create a program. But it was just compassion and learning those stories. And really my advocacy at this point is for psilocybin. I'm learning about other forms of psychedelic medicine, but right now New Mexico's on a psilocybin approach, and that's what our bill does. It creates a medical psilocybin program.
It's a very turbulent period for the United States. Do you think that psilocybin can play a role in help to deal with these issues and the growing polarization, political polarization, maybe?
Well, perhaps. So you're saying we get the president and the congressional leaders together in a group retreat, and why not? They could do a lot worse. But, listen, anything we can do to help the human condition is good for our country, because political aggression and what we see in the world of politics is its own problem, and I don't know. But if psilocybin can help people and their results of the trauma in their lives, then it's really about people. So if we can help the people, and sometimes what we see in government is that states are leading the way. It's not the federal government that's leading the way, sometimes it's states. And so, and this is what happened with cannabis, medical cannabis. It was the states who led the way, even though it was illegal federally. States started creating medical programs, even though they did it under the threat of the federal government being able to swoop into any one of those states and shut it down. But we said we can help people, and we did. And now this is and then hopefully the federal government will come along. So we have a new, obviously, presidential administration in Washington in the United States, and hopefully they will be supportive of states doing this in the name of harm reduction and good science. And that is my encouragement of them.
So you are hopeful about the future?
Absolutely, you have to be. And you can't not help people because of fear. And that's not a courageous approach to helping people. My job is to empower people with the truth and with data. And that requires you to be courageous sometimes, and sometimes for something that shows that everyone is supportive of, and sometimes it means you're the lone guy, and it's scary. But it's all about helping people, and that's what we're really talking about with medical psilocybin, I believe. But I know more, and that's what the data has shown. But we're going to learn lots more in the future, and New Mexico is going to be part of that.